Warm welcome everyone. This video is about my first Gatt surgery which was performed in a 6-year-old child. There are no financial interests. Gatt is a sutureless, blebless ab interno trabeculotomy for control of IOP. This involves making 1 to 2 hours of goniotomy and passing a 50 Prolene sutures into the Schlemm's canal. So the patient had an IOP of 42 millimeters and 40 millimeters of mercury of medications and a cup disc ratio of around 0.8. So this is my first Gatt in a child as a senior resident. Firstly, the surgeon is sitting temporally. A paracentesis is made at 3 o'clock. Pilocarpine is injected into the anterior chamber to constrict the pupil. A dispersive OVD is injected into the anterior chamber. Now another paracentesis is made at 10 o'clock using MVR knife. A 50 Prolene suture is pre-placed through this second side port. The suture ends are already blunted using a cautery. Now, after tilting the microscope and patient's head, a gonioprism is placed over the cornea after putting viscoelastic. Now the anterior chamber is again entered using an MVR blade. An initial goniotomy is made around 1 to 2 clock hours, exposing the Schlemm's canal. Viscoelastic is injected at this point to make space and dilating the Schlemm's canal as well. This is an important step. Now, using an intraocular max grip forceps, the suture is held and it is pushed into the Schlemm's canal. The suture is held and it is being pushed into the Schlemm's canal through the initial goniotomy we made. As you can see, the suture is now in the Schlemm's canal. Now, using the same max grip forceps, we keep pushing. After around 15 to 20 passes, we can see that the suture will come out from the opposite side. So here now we notice that the suture has come from the opposite side. Now again injecting the viscoelastic to make some space. So now this proximal end of suture is now held with the max grip forceps, which is inside the anterior chamber, and using a second forceps we hold the distal end of the suture. Now we pull the distal end and 360-degree trabeculotomy is done by the suture. Now since the patient is a child, pre-placed 10-0 nylon sutures are put. These suture ends are not tied now. So after pre-placing the sutures, viscoelastic and any hyphema is removed. And a bubble is injected into the anterior chamber. Now the suture is tied and the ports are sealed. Now both sutures are tied and the ports are sealed. Again giving a final wash to remove any blood. We want the anterior chamber to be tight. If the IOP in the anterior chamber is low, then the bleed will occur. That's it, the case is done. Post-operatively, the patient did well. At 3 months, the intraocular pressure was 10 and 12 millimeters of mercury of medications. There were no serious complications. The major advantages are effective in controlling IOP and reducing topical medications, sparing of conjunctiva, no bleb-related complications, and early post-operative recovery. Thank you for your kind attention.